Right. So if you have read and understood, considering it
Yes,
clinical examination station, kindly please begin.
okay, ma'am. Um, um, Hello, I'm Dr. Ishita, one of the surgical doctors here. May I confirm your name and age, please?
Lisa, 55 years old.
Okay. Nice to meet you, Miss or Mrs. How I can address you,
Mrs. Lisa.
please?
Mrs. Lisa.
Okay, Mrs. Lisa. I'm going to examine your hands, and I'm going to do some palpation, do some inspection and palpation, and examine your movements of both hands. Are you okay with that?
Yes.
Would you please expose your both hands up to elbow joint, please?
Okay. Yes.
Okay, please put your both hands on. There is a cushion here, and be comfortable. If any
Okay.
problem, please let me know.
All right.
First, please show me both of your palms, and then I will ask you to show both of your dorsal of hands. And now I'm going to inspect both hands and
Yes.
forearms for any kind of scar and swelling and any kind of skin change, skin color, and
Yes.
if there is any visible asymmetry, deformity, or any kind of muscle wasting there or not. And
Yes.
the inspection, I'm going to palpate your both hands and forearm. Are you okay with that, please?
Yes.
I'm going to see if there's any tenderness. Do you have any pain in any of your hand and forearms, please?
Not that much.
Okay. I'm going to check first the temperature of both hands, forearms, and wrist joint, and then I'm going to check the tenderness of all the joints individually by manual examination. And then now I'm going to check both forearms and both elbow joints if there is any rheumatoid nodule present or not. And now I'm going to check both anatomical snuff box for any kind of tenderness, and I'm now checking both ulnar pulse and radial pulse. And now I'm going to put this cotton on your forehead.
Yes.
Please tell me, can you feel it or not?
Yes.
Okay, and now would you please close your eyes, and I'm going to put this cotton in your both hands and forearm,
Okay.
and let me know if you can feel it just like that or not.
All right.
Okay, I'm checking your the dorsum of first rib space of both hands. Can you feel it?
Yes.
Okay. I'm checking both sides, both hands simultaneously. Now I'm checking, putting this cotton on on other side of little finger. Can you feel that?
Yeah. Yes.
In both hands. Okay. Then I'm checking volar surface of index finger. Can you feel there?
Yes.
Okay. Now I'm going to check your movements. Can you follow me? Like I'm doing the movements of hands. Just follow me.
Okay.
Please make fist by both of your hands.
Yes.
Now open your fist and spread the fingers, please.
Yes.
Okay. Now, would you please make your make this prayer sign like me, please?
Yes.
Okay. Now, just do this reverse prayer sign.
Yes.
Please hold this for 60 seconds. Do you feel any kind of pain, numbness
No.
on your fingers?
No.
Now, please do these movements like me of your thumb. Uh,
Okay.
I'm checking the flexion, extension, adduction, palmar abduction, dorsal abduction, and opposition of both thumbs. And
Okay.
now I'm checking the passive movements of both hands to see any crepitus present or not in any interphalangeal MCP joint or wrist joints. And I'm checking now the individual FDP and FDS tendons um, of both hands. And
Okay.
then I'm going for Miss Lisa, please hold my squeeze my fingers by your hand. Can you
Okay.
feel any kind of weakness or slipping away?
Yes.
Okay. Can you pick up this coin from my hand by both of your hands individually?
Okay.
Okay. Now I'm checking. I'm going for nerve tests. Um, First, would you please
Okay. Can
now
you
first
please summarize your examination now?
I've examined a 55 years old female,
Yes.
Mrs. Lisa, who complains of pain, tingling sensation, numbness, weakness in her right wrist for 3 months, and
Yes.
she has a weakness, mild weakness on a power grip,
Yes.
and there is no sensory deficit of median ulnar or radial nerve uh, supplied area, and there is no visible wasting in thinner or hypothinner area, and on palpation, there is no the local temperature is normal, and there's no tenderness in individual joints, and there's no rheumatic nodule palpable. And on
So,
checking the active and passive
yes.
movements, uh, the active movements and passive movements are also normal in both hands. And
Okay. On your,
I could not check the
after
nerve.
your examination, what are your provisional and differential diagnosis?
After my examination, my provisional diagnosis is carpal tunnel syndrome,
Yes. And differential diagnosis?
and differential diagnosis may be cervical disease or diabetic neuropathy hemoplasm.
If time would have allowed you, how would you have completed your examination?
I would have completed my examination by full neurovascular examination of both hands, and I will also check the elbow joints.
Okay. What are the management alternatives that you can offer this patient?
Management alternative, I will first investigate to identify the underlying cause,
Yes.
and I will check the preliminary tests are electromyography and nerve conduction study.
Yes.
And to check the underlying cause, I can do an MRI if there is any local cause or not. I can do an MRI of both wrist joint, and I can go for blood sugar and thyroid function test to exclude the underlying uh, disease.
Okay. What is the role of electrophysiologic studies like electromyography if you have to manage the patient conservatively?
Ma'am, electromyography will help me to determine if there is any weakness of the median nerve innervated muscles.
Yes.
Uh, and
How is it carried out? Can you explain it to me?
the nerve potentials
You have to
are measured.
splint. Yes, you have to splint the wrist first, especially at night time for minimum
Yes,
of
ma'am.
3 weeks.
For mild to
Yeah.
moderate symptom, I will have to splint the wrist joint at night time for 3 weeks, and then I can give I can give injectable steroid in the carpal tunnel,
Yes.
and I can give NSAID and with or without diuretics.
If it
And
doesn't work, then you
if doesn't work, then I go for surgery.
Yes.
The surgery is carpal tunnel release by Z+.
Okay, Bell has gone, but just for discussion's sake, can you please tell me if it has to be carpal tunnel syndrome, what are the sensory and motor deficits that you'll come across your examination?
Sensory deficit, there will be impaired sensation on lateral 3.5 finger, and
Which aspect? Palmar aspect.
on palmar aspect.
Yes.
Palmar aspect.
Yes.
And there may be thinner wasting, and there may be weakness of the median nerve innervated muscles.
Yes, and there'll be positive Fallon's and Tinel's test.
And positive Tinel sign and Fallon's test.
Which test is better, MRI or CT scan to rule out carpal tunnel syndrome?
Sorry, ma'am.
Which test is better, MRI scan or CT scan to rule out carpal tunnel syndrome?
Here, MRI is better.
MRI is
MRI is better
Good.
to see the soft tissue.
Okay, good. Thank you.